Hello, everybody. This is another
Good.
episode of our podcast, Artificial
Mm-hmm.
Intelligence, Cybersurgery. This is Dr. Andrew Gumbs. My co-host, Dr. Vincent Grasso, is actually in New Mexico, visiting a university over there for some projects in artificial intelligence. And I have here Professor Takeaki Ishizawa from Osaka University now. Am I right, Takeaki?
Yeah,
And
Osaka Metropolitan University. This is uh, another uh, another academic institution in Osaka.
yeah,
Mm.
yeah. You were before you were in Tokyo, right?
Yeah, I worked at the Tokyo University Hospital,
And
and from the last April
last April.
last
Where
year,
where
yeah.
where are you from originally?
Originally, yeah, I was born in Tokyo.
Ah, okay, okay.
Yeah,
And,
and my
and
but I graduated from the Chiba University. Chiba is the prefecture next to Tokyo, not so far.
they have a famous baseball team in Chiba, no? Right?
Uh, Not so famous, but yeah, there is a baseball team in Chiba.
Okay, okay.
Mhm.
Not so famous. Who's your favorite baseball team in Japan?
Yeah, I'm a big fan of Tigers. Tigers is located in Osaka, so it's
Ah,
very good for me. I'm happy
okay.
to be here.
So congratulations on the
WBC.
win against
Thank
America,
you very
right?
much. And yeah,
3-2.
against Mr. Trout. Yeah.
Yeah. That was a great
Mm,
game.
that was a kind of let's say movie scene, right?
Yeah,
Mm.
yeah. Absolutely. It's just great. So maybe you can tell people when we first met. How long ago was that? How we know each other?
Uh-huh.
See if you
Now,
remember. Yeah.
it's me. So should I introduce myself?
Yes, of course.
Uh-huh.
Yeah.
Okay. So this is already recorded. So
Yeah. We're recording now.
okay.
Yeah.
Yeah. Um. Sorry for that. Uh, I am Takeaki Ishizawa, working at the Osaka Metropolitan University as a professor of the hepatobiliary and pancreatic surgery department.
Yeah.
Last year, we had approximately 100 and 200 hepatectomies and 100 pancreatectomies by open lap and also robot-assisted approach.
Great. Yeah.
Mm. And you previously introduced, I graduated from Chiba University in Japan in 2000
Yeah.
and went on to the University of Tokyo to study clinical practice and research on HBP surgery under Professor Makuchi. Do you know Professor Makuchi?
Of course.
One of the very famous, yeah.
Yeah, as you know, Brice Gaillet, who I trained with in
Yes.
Paris, he
Mm,
did his PhD in anatomy with Makuchi, and Professor Gaillet actually described the retrocaval ligament. He's the one
yes.
who described it. I know in Japan it's
Mm.
known as Makuchi's ligament,
Makuchi's ligament. Yeah,
but in France,
so many surgeons in Japan uh, call that ligament as Makuchi, but in France, a lot of liver surgeons are saying
yes,
that this is Makuchi.
yeah, but a
It was
lot
really
of liver
interesting. Mm.
surgeons also call it Gaillet's ligament. Did you know that?
Gaius ligament, really.
Yeah. Because
I heard,
he was the student who described, you can have one to
yes.
three ligaments going under
Mm,
the vena cava because I
mm,
think he was
yeah.
working. He has a PhD in anatomy that he did with
Yeah.
while he was with
Mm.
Makuchi. Yeah.
I heard that the numbers of the vessels in that ligament is a research PhD subject for Professor Gaye, right?
Right,
Mm.
exactly.
Mm.
Yeah, yeah.
Yeah.
So then now did you train with Gaillet also? Did you come to France?
Recently,
No, back, did you do a
yeah.
period?
That was in 2011. I stayed in
Right.
Paris to master laparoscopic surgical techniques because at that time the laparoscopic techniques in Japan were really poor for me, and
Yeah.
for me it was very important to reproduce the Professor Makuchi's very sophisticated hepatectomy in lab, but
Yeah.
I didn't know how to do that. But at the SAGES meeting in the US, that was the Phoenix meeting.
Yeah.
I had a chance to listen the Professor Gaia's presentation, and he showed the amazing resection, laparoscopic hepatectomy of segment 1, complete resection of the caudate lobe. And I was really impressed, and I ran to him to ask that please let me be a fellow at the IMM. So in 2011, I finally had a chance to stay in Paris to master his laparoscopic techniques.
And how long were you there for?
Just for 10 months.
Yeah, that's a long time.
I don't think so.
Well, like me, I spent 1 year with him in Paris from 2006 to 2007. I mean, you learn a lot. It's
yes.
amazing to work with him.
The good thing was that he had, as you know, a very big library of previous laparoscopic surgical videos in his room. So every night I brought some of the cassette or the videotapes to my home and watched his techniques. So that was very good. And we wrote a textbook written in Japanese.
Nice.
To introduce his surgical techniques to Japanese surgeons.
So I always remember. I know you love to remind me of this story, but I'm going to let you say it again anyway. We wrote a paper on the laparoscopic. You know, you, me, Makuchi, Professor Makuchi, and Professor Gaye on laparoscopic approaches to all the different segments. And I remember you. I'll let you tell the story. What did you ask me? You said maybe we should submit it to Annals of Surgery. And what did I say?
Yes. I thought that this is a really great techniques and will be good, very valuable information to the readers, because nobody can complete such a beautiful anatomically accurate hepatectomies in lab. But Andrew watched his surgical techniques too much, so you may be unable to understand the value of his that article. So when and you revised the manuscript, and we discussed to which journal we should submit that article, and you didn't recommend the Annals of Surgery, but for me it's very important to be accepted in the Annals of Surgery.
Right, and remind me, where did your article end up getting accepted?
Excuse me.
And where did it get accepted? Into which journal?
Annals of Surgery.
Exactly.
Yeah.
Exactly. So you were very right, and that was great. It was great to be a part of that with you. Thank you.
Yeah, me too. Without your revisions, maybe that article cannot be accepted by in Annals of Surgery.
It was a great collaboration. It was great.
And you know that? Do you know the one of the reviewer was a very famous French surgeon?
Oh, really? Who?
Yeah.
You don't want to tell me who it was?
I can say his name in this.
You'll tell me later. Oh yeah, you tell me later. That's funny. That's funny. Now, I went to visit you in Japan. I can't remember what year, but I remember you invited me to your home. Do you remember that?
Yes, I remember. Of course, I remember that.
I remember
we had a very good
sushi dinner. I never saw so much sushi in my life. And I met your lovely wife, and I remember seeing pictures of your wedding. You were married actually in Florence, right?
A small, a very small but a beautiful church.
Yeah.
Close to the Firenze.
Yeah.
That was my wife's dream.
Yeah.
I don't think you can understand the situation, but at that time it was a kind of boom in Japan to get married in the outside Japan.
In Europe.
especially in Europe or in
Yeah.
Hawaii or some beautiful place.
Yeah. No,
We are not
that's
Christians, but
yeah. Yeah. But beautiful. As
yeah,
you know,
but yeah.
my mother is Italian, so I love I was very happy to see that in your home. And I also remember you had the entire collection of Blackjack, the
Blackjack,
manga
yeah,
Blackjack. Can you
manga
tell,
blackjack.
surgeons outside of Japan don't know who Blackjack is. Can you tell a little bit about Osamu Tezuka?
Osamu Tezuka,
Yeah.
yeah, Osamu Tezuka is the giant who born the manga. Manga is recently everybody read manga, but before Tezuka, there was no manga.
Yeah.
And the Blackjack is a very funny story. The Blackjack is a name of the really genius of surgery and very talented and good surgical skills. He can transplant the brain, for example.
Yeah.
But we can feel reality in that kind of story. So this is the magic of Tezuka. And a lot of surgeons were impressed by the blackjack in Japan. So I think that without blackjack, the number of surgeons in Japan will be very, very small. Not so
Yeah.
much here.
Yeah, I was so shocked to see that in Japan, essentially he's like a Marvel superhero. He's basically a character in a comic book who has these incredible abilities, and he's a surgeon, and he dresses in black.
Yeah.
He operates without a license. He does surgeries that nobody else can do. I mean, surreal surgeries. And there's one thing I like about him in particular. When he was a child, the backstory was that he was in a horrible accident.
Yeah.
A surgeon put him back together, and there's a story where he's missing a piece of skin over his face. So he gets a skin graft from a
Yeah.
boy, a half black, half Japanese boy.
Yes.
So Blackjack has on his face this black or this darker piece of skin on his face.
Yeah. And
It's
this is a perfect introduction of Blackjack. Thank you very much.
And there's a surgeon in Japan. Is it I think is it Kato who's at Columbia? He's a transplant surgeon. What is his name?
Yeah.
I can't remember his name, but there's a very famous Japanese surgeon who works at Columbia who does these incredible transplants of takes the liver out of the patient and cuts it, puts it on the back table, cuts it in half, reconstructs it, puts it back into the patient. And I was told that some surgeons in Japan call him Blackjack. And there's even an episode of Blackjack where he goes to Columbia University. This is Blackjack's written in the 1970s.
Kato, maybe.
Kato, right?
Kato.
And the surgeons in America, Columbia, are very arrogant, and Blackjack comes and saves the day. It's for any surgeons out there, I highly recommend you read the collection. After I went to your house, I came back to America and I bought every Blackjack comic, and I reread the whole thing. It was amazing.
Yeah, I think that was that. The Blackjack is the good textbooks for students, medical students, and high school students, maybe.
Yeah, because the interesting thing about Tezuka Osama or Tezuka Osamu?
Osamu.
He actually went to medical school. That's why some of the
in
designs
Osaka. He graduated from Osaka University.
Oh, I love that detail. Because some of the designs in the book of the surgeries are incredible. They're perfect. They're beautiful. Yeah. So this is, I should mention, this is a podcast, called Artificial Intelligence and Cybersurgery. It is from our journal, which you're one of the editorial board members of Artificial Intelligence Surgery, the first journal, it seems, in the world that's focused and dedicated specifically to artificial intelligence and surgery. So you're one of our editorial board members. I know you work a lot with indocyanine. Can you lower your camera a little bit because your face is a little
sorry for that. Yeah.
So So that's perfect. So you work a lot with indocyanine, which is really kind of I wonder if we could call it a form of augmented reality, if you will. I mean, it's a biophotonic imagery. It's really an
Mm.
enhanced image. Do you use it mainly for liver tumors, or do you also use it for vascularization during gastric surgery? What do you use indocyanine for?
Yeah, yes. Actually, since 2007, I have developed fluorescence imaging techniques, mainly with the use of ICG for visualization of the bile ducts.
Since
And
2007? I mean,
yeah,
you're one of the pioneers in that field then. That I didn't know that.
I think so, but
Yeah,
I hope so. But yeah,
I can say
mm,
you're a pioneer.
yeah. The originally we developed the application of ICG fluorescence imaging to bile duct imaging, so-called fluorescence cholangiography.
Right.
And in 2008, I had a chance to use ICG for cholangiography in my clinical case of lap chole. At that
Right.
time, only the prototype near-infrared light laparoscopic system that was available.
Right.
Just two systems are
Wow.
available in Japan. And one day, I actually used that prototype to the lap chole case.
Right.
And this case was reported in the uh, archives of surgery in 2008. I
Nice.
think that was the first case of lap chole with the use of fluorescence cholangiography by IVICG. It's
Interesting.
the the value of this technique is that we don't have to cut the cystic duct to to make any incisions on the bile ducts to insert the
Yeah.
uh,
Yeah. Of course.
catheter for the injection of contrast materials, and
Yeah.
also we don't need radiation. So this is a good advantages over
Right.
the conventional radiographic imaging. And
Right.
this is
Of
the
course.
fluorescence cholangiography. And following that, in 2008, when I use fluorescence imaging system during hepatectomy for the cholangiography, I found that the liver tumor uh, emitted very strong fluorescence signals
Wow.
before we use ICG intraoperatively for cholangiography. And
This was in what
uh,
year was this? What year was this?
2008,
Unbelievable. I didn't
mm,
know this backstory. Oh, please continue.
really.
Yeah.
So I was very, it was very, it was
Impressive.
amazing, but yeah,
You were
impressive, yeah.
very impressed. Yeah.
But originally, I couldn't understand the background of these fluorescent signals emitted from the liver cancer. But
Yeah.
in Japan, and especially in the Tokyo University, all patients undergoing liver resection underwent a preoperative liver function test by intravenous injection of ICG, so-called ICG retention rate. This
Yes.
examination is very important to estimate the upper limit of liver volumes to be removed. So this is a routine liver function test. So I thought that the ICG would be accumulated in the liver tissues. And after that, I started the prospective study to confirm the background. Yes, and in fact, the uh, hepatocellular carcinoma, the primary liver cancer with the good differentiation can uptake the ICG into the cancer tissues. So the
Wow.
whole of the cancerous tissues can show fluorescence signals. But in contrast, in poorly differentiated hepatocellular carcinoma and liver mets from the colorectal cancer,
Uh-huh.
the ICG cannot be taken up into the cancer tissues because there are no uptake transporters in that kind of adenocarcinoma. But
Okay.
there are the biliary retention around the tumor.
Right.
So this kind of tumors can be identified as a ring fluorescence signals, ring as a
Right.
ring.
Like ring
So
enhancing by
yeah, yeah.
with fluorescence.
But anyway, regardless of the fluorescence patterns, we can use this phenomenon for the intraoperative visualization of the liver tumors,
Right.
regardless of the fluorescence patterns. inside, outside, we can detect the tumor. So we start using this technique in the from the open hepatectomy.
Yeah.
And after that, a lot of the laparoscopic near-infrared light camera systems became commercially available. And the indication of laparoscopic hepatectomy is increasing. So a lot of surgeons have become using fluorescence imaging for the localization of the liver tumors.
So you use indocyanine only for liver tumors, or use it for other indications also?
Yeah, basically, this technique is useful only for the liver cancers
For you.
because no bile juice outside of the liver.
Right.
But
Because you only do hepatobiliary. You don't do other things.
yeah, I do pancreatectomies, but for the visualization of the pancreatic cancers, we need new fluorophore other than ICG.
You need a new agent. Interesting.
Yeah, so recently a lot of researchers and surgeons are developing cancer-specific new agents for visualizing the each type of the cancer.
So you still use indocyanine for colorectal mets, or only for hepatocellular, or use it for all liver tumors?
Both.
So is there a different time that you inject the indocyanine for the different tumors, or is it just the day before?
It depends because it's very difficult to adjust the interval between the injection of ICG to the surgery because in clinical situation, the patients may be admitted to the hospital in the different period. And in Japan, we have to use ICG for liver function test. And sometimes we need this information a week before surgery or something. So, you understand? So
it's hard to time it.
But basically, it's better to avoid injection of ICG on the day before surgery, especially for a patient with a decreased liver function, such as cirrhosis or the fatty liver due to the chemotherapy. So 2 or 3 days prior to surgery would be the best timing.
In general. Oh, interesting.
Yeah,
okay.
in general, yeah.
Well, this is I'm ashamed I didn't know how intimately involved you were
So
with
please.
You are too modest. So this is no, but in all seriousness, I know, we have talked about you being a guest editor for a special issue on indocyanine, and you think it's too early for this, but I mean, judging by what you're telling me, absolutely, we need to do a special issue. It would just be, one article would be about you writing about your experience, just like an editorial explaining the history of indocyanine. Is very important because I find it fascinating, and then we would just need 4 other articles on topics of indocyanine, and that's it. Because again, artificial intelligence and indocyanine, they're kind of overlapping because you're augmenting visualization. I personally think it's a form of augmented reality. So this is a debate of semantics of whether it is or not, but I think it's an amazing form of visualization, and I think it would be a great topic.
So basically, the combination of the fluorescence imaging and AI is very a good combination to create the future intraoperative navigation. For example, recently some researchers are developing the new AI-based intraoperative navigation, indicating the location of the bile duct during the cholecystectomy. But this deep learning is based on the human writing of the bile duct. So just the estimation of the place of bile duct. But the fluorescence imaging can visualize the actual location of the bile biliary system. So we can input information of fluorescence cholangiography to enhance the quality of AI-based indication visualization of the bile duct. This is one possible idea.
Of course, it's fascinating. No, I mean, I would love. I mean, it sounds like you must know all the leaders in this space in the world. I think just topics on this on these merging fields of, do you call it biophotonics? What term do you use, like a global term to describe? You just call it fluorescent imaging? Some people call it biophotonics. What do you call it?
Biophotonics, yeah, fluorescence imaging, it would be common,
Yeah.
commonly used, fluorescence imaging,
Okay.
or fluorescence guided surgery, or
Yeah.
optical guided surgery.
Because I really feel like, optic guided surgery and, augmented reality are really,
Yeah.
they're going to merge into the same field.
Mm-hmm.
So anyway, I'll bother you with emails about the special issue, but I because I personally can't wait to read these articles. I want to
Really?
I want to learn more about
Mm.
about this field. So I think it would really be wonderful.
Yeah, problem is that recently the fluorescence imaging has become very, very famous.
Yeah.
So a lot of this kind of special issue or special articles are
Right.
available. So I think it may be difficult to differentiate our project from the other.
Exactly, but if I think if you can get people who will talk about the merging of this imaging with artificial intelligence, and again, just in a theoretical phase, I think it would help people understand,
Uh-huh.
you know, how to merge imaging in 2023. Because imaging is not just going to be fluorescence, it's not just going to be augmented reality, it's not just going to be virtual reality. It's not, it's going to be a fusion of computer vision, and I think it's a complex topic,
Yeah.
and it, if we can find the authors, it could be very interesting. Anyway, we'll think about it more. But at least that article, the one you just described about your involvement and with the development of this, and your thought of how to use artificial intelligence to merge this, that would be just an editorial. I would love for you to write an editorial on just what we're talking about today.
Yeah. If I can have a chance, yeah, I'll do
Yeah,
that.
yeah, of course. I mean, it's 6 months whenever whenever you
6 months.
can, and by all means, I would love to, I can help you with it. It would be great because I'm fascinated in the topic.
Yeah, I think that in this year and from now on, this kind of articles focusing on the combination of the fluorescence imaging and the AI-based navigation will be increasing.
Yeah.
So sometimes I had a chance to review this kind of study.
Yeah. No, exactly. So I really please write an editorial for us on this topic. And if I can help you in any way, it might be easier for you, whatever you want.
Okay.
Okay. So I know it's late in Japan, and I know you have a wife and kids. So I'm gonna let you go. We're way past our, usually we do this for about 25 minutes.
Thank
So
you
we're
very
past.
much.
It's so wonderful to see you again,
Yeah, thank you
Takeaki.
very much for inviting me to this
Yeah.
podcast. Yeah.
Are you gonna come? You coming to Europe anytime soon? Are you gonna come to the EHPBA in Lyon in France in June?
No.
Uh,
I may go to the Istanbul to the EA Asian Endoscopic Surgical Society held in the Istanbul, Turkish.
yeah. What month
But
is that in?
hmm?
Is that this summer?
This summer, yeah, maybe
Okay.
September, maybe
Oh,
October, maybe.
September. Okay.
Mm.
Well, anyway, we'll have to coordinate. It's been too long since we've seen each other.
Thank you very much. Yeah,
Okay.
I look forward to. Yeah.
All right.
Okay.
Have a
Bye bye.
great night. Say hello to your
Have a good
wife for
day.
me.
Thank you
Okay.
very much.
Okay.
Okay. Well, see you soon. Bye bye.
Bye, Takeaki.